Hello, I'm Liz Cooper, Assistant Director of Public Communications here in Union County. And with me is Public Health Director Dennis Joyner and Medical Director Dr. Stephen Keener. Thank you both for joining us to answer a few questions that we're hearing from the community. Before we get to those questions, we'd like to get just a brief status update on COVID-19 in Union County. Dennis?
Well, thank you, Liz. Unfortunately, we're in a pretty big surge of new cases and high positivity rate here in Union County. Over the past month, we've seen a pretty large increase in those new cases. So we're kind of up to where we were in December of last year when we had the large surge that led over into January. And so the one thing that's unique about this year is that we are dealing with a new variant that is highly transmissible, more transmissible than the time last year. So we're not in a very good place in terms of our metrics for COVID transmission in Union County.
Thank you, Dennis. As you both know, there's a lot of misunderstanding about COVID-19, including measures to slow the spread. That has prompted a lot of questions, concerns, and comments from the community, as well as sharing of some inaccurate information. I'm going to ask you both several questions to provide the community with the facts. Starting with Dennis, why do you recommend masks be required in schools?
Well, the short answer, Liz, is because it's a way for us to keep more kids in school in a healthy way. Masks, I realize there's a lot of anxiety and different sides about masks, but the truth of the matter is masks are a great opportunity to create a safer environment, to layer the levels of protection that we see in schools where you're going to have large number of children gathered. And so the Strong Schools Toolkit advises that, and we support that, and we think that's an important thing to have happen, particularly now that we are in a high transmission level in Union County.
Dr. Keener, who has the authority to issue county-wide public health mandates?
Well, there are two sources of public health mandates in Union County. The first is a local health director who can issue isolation and quarantine orders. And the other one is the Union County Consolidated Human Services Board, which can issue public health rules.
So the Board of County Commissioners is not normally involved in public health mandates here in Union County.
That is correct.
How is requiring masks in schools different from a county-wide mask mandate?
Well, we don't have a county mask mandate in Union County. However, it is strongly encouraged that people wear masks in public indoor settings. But adults can kind of control their environment and avoid risky situations by where they go and when they do it. Adults can also get vaccinated. On the other hand, we want our children in schools learning, and classrooms are indoor, in-person environments with kind of close quarters. There are people in classroom settings who are particularly vulnerable to serious illness due to COVID. And some people in school environments are not eligible to receive vaccines. So because of those factors, the classroom is a high-risk environment where additional steps like masking make a lot of sense.
Dennis, what is your guidance for schools, and what are the current quarantine guidelines for UCPS?
We've been very consistent, Liz, with following the Strong Schools Toolkit that has been supported by the state and actually developed by the state. It's a safe way to respond to COVID in the school setting. And so we continually have been recommending that they follow the guidance that's in the toolkit. In terms of quarantine, in any situation where there's been an exposure to someone who has COVID, there is a quarantine period, which is very important to determine whether or not that person may develop symptoms. They're healthy at the time, and they may not get symptoms immediately, or they may not get it at all. And that's what we certainly hope. But we recognize that the quarantine period is an important way to keep schools operational, even though it's unfortunate in that it takes people out for a period of time. So 14 days is the normal standard that is in play. There is also other options that can be available for folks to shorten that quarantine period if they've been vaccinated, if they have had COVID in the past 90 days. So there are some options there. There's also some modified options as well that could be utilized if other conditions are in play.
Why do healthy children have to be quarantined?
So there's two tools that we have. One is quarantine, one is isolation. Isolation is when a sick person is sent home to prevent the illness from being spread to others. It makes a lot of sense. Quarantine is specifically designed to take healthy people who have been exposed to an illness and separate them so that if they do get sick, then they are not unknowingly spreading it to other people. Now, the length of quarantine depends on the incubation period for an illness, and public health has used quarantine as a tool for many years for a variety of different diseases. But if, in this context, if someone has been vaccinated, if they have had a positive viral COVID test within 3 months, or if both the source person and the exposed person were masked and there are no symptoms, then quarantine is not required.
If you recommend masks in schools now, at what point does your recommendation change?
Well, Liz, I think there's a lot of concern that once we go to masking that we'll stay in masking forever. And we want to be practical about this. And certainly it's not masking forever, it's masking for now. And we're looking at things that can help us understand when the transmission levels start coming down and we get back to those levels like we were in the summer, in May and June, where our positivity levels were down, as well as some of our case rates were down, and the hospitalization numbers are down. When that transmission level comes down, then certainly it would be advisable to relook at the mask optional as a possibility. And so, you know, I think that's an important point that people need to understand. This is a key piece for us when we're now in high transmission.
We've heard from a lot of parents who want you, Dennis, to require masks in schools.
Well, the local health director does not have the operational authority to make those decisions in the school system. So that is left to the school board in terms of making those kind of decisions.
How often are you in communication with UCPS officials?
I'm in communication practically on a daily basis with the school health staff, along with the school administration. We talk about all the trends that we're following, the concerns and issues that they're seeing in the schools. But yes, we're almost daily in communication with the school system.
Why are COVID-19 vaccinations important, and why do you recommend healthy individuals get it?
Well, vaccinations against COVID-19 they're safe, they're effective, and they're available for anyone who's 12 years and older. Vaccinations are our best protection against COVID-19 and our best chance to stop spread and end this pandemic.
Is natural immunity more effective than vaccine immunity?
Well, I know there's a lot of talk about this, but there have been several recent peer-reviewed studies that have come out since Delta has been around, which show that vaccine immunity is actually about twice as effective as natural immunity.
Are COVID-19 tests effective?
We have COVID-19 tests which are very accurate. The most accurate is a PCR test, which is considered the gold standard. It actually measures viral DNA. It's been used for decades for other types of viruses. Then we also have the antigen tests, or some people call them the rapid tests, which are also pretty accurate, but in some cases they do need to be confirmed by a PCR test.
How is COVID-19 different from the flu?
Well, in many ways, there's a lot of similarities, and that confuses some folks. A lot of the symptoms are very similar. Obviously, they're different viruses. One thing that we've learned is that COVID-19 is a more contagious virus in how it spreads, and it can spread very, very rapidly, and oftentimes very quickly in close environments where you can have pockets or outbreaks, kind of super spreader events. So it's different in that regard. It's also important to note that you really, if there's someone symptomatic, you really have to be evaluated to determine whether or not it's flu or COVID-19 through testing and other medical evaluations.
Thank you both so much for providing this information today. For more COVID-19 information, visit our website, unioncountync.gov/COVID-19.